Welcome to AI Rounds, your weekly dose of AI in medicine and education.
We are your hosts, Dr. Núria
and Dr. Morgan Leaf. Each week, we'll bring you a quick dive into the latest in artificial intelligence and how it's transforming healthcare, medical education, and medical communications.
From the tools changing how we teach, learn, and write, to breakthroughs shaping patient care. If it's new, exciting, or just plain useful, we're talking about it.
In just 10 to 15 minutes, we'll get you up to speed and maybe even spark your next big idea.
Let's make the rounds. Welcome to AI Rounds, where we explore how artificial intelligence is reshaping the way clinicians learn, think, and teach. So I just came back from ChangeMedEd 2025 in Chicago, and this year AI was everywhere. The mood was reflective and forward-thinking, so less hype and more integration.
So I have two questions for you, Núria. What were the types of attendees at this conference? Can you give us an idea of what folks were there? And then what was the vibe like? Are people still excited? Are they overwhelmed? How did it feel?
Okay, so what types of attendees? So this is a conference organized by AMA, the American Medical Association, and it's mostly people that work in academic medical education, so undergraduate and graduate medical education. So there was a lot of university people, basically, and then there were also some medical students, which was interesting as well. So medical students that are interested in medical education. It's very, what's it called? Meta? No, it's not. I think whatever. Let's go with meta.
Right. I like it.
Yeah. And it was like people in terms of backgrounds, like a little bit like us in the Alliance. They were like doctors, but also people that educate all types of healthcare professionals. So not just clinicians, but also nurses, nurse practitioners, etc., pharmacists, everyone that works in healthcare goes through some sort of formal academic medical education. And these are all the people that think about medical education and then teach all of the different disciplines. And then the vibes were, I think, excited and thoughtful. So it's interesting, right? So every single session, not all sessions were about AI, but AI was, I would say, a significant component of every session. So even sessions that were not about AI, there were lots of sessions about reimagining residency, for example. AI was a part of those sessions as well. And mostly from the stage, what we saw was a lot of excitement and a lot of demonstrations of how to use AI and how to incorporate AI into medical education. From the audience, there were obviously some people that were still like, I'm not too sure about this. So I think the excitement was really palpable from the speakers, from the audience. It was very mixed in terms of like excitement and like, this is just hype. But I also thought that it was very thoughtful. I think I was like texting with you and other friends that we have like throughout the time, because they are thinking of incorporating AI into so many aspects of medical education, like almost everything to do with medical education, including like, for example, having AI platforms that like look at the notes that students are writing and then keeping track of that there was also a lot of thoughtfulness in terms of like, are we like just starting to, what's it called? Are we like surveilling people too much? And like, is this really helping our students or not? Will this result in better patient outcomes or not? So there's also a lot of thoughtfulness. I think the question definitely has shifted, and everyone has said that many times during the conference, like, should we use AI to, how do we actually use it responsibly? So, yep, that was kind of it. AI is in the water now.
That's amazing. I mean, I think back, I feel like I just graduated from medical school yesterday, but it's been almost 20 years now.
Yeah.
And it's just entirely different. It's even entirely different from 10 years ago when I was an associate program director at a residency program. And to me, I see so many benefits of incorporating AI into medical education, but I understand why people are weary of things. Doctors as a whole are weary of new things with good reason. We like proof that
Yes.
things work.
Mhm.
So, with that being said, what types of projects stood out to you?
So there was like lots of really cool AI projects presented from both faculty and students, which was interesting. So some students also presented on AI projects. One that I thought was very interesting was this project from the University of Michigan called Data MD, where they are really thinking through how do they integrate AI into evidence-based medicine. If you think about it, there are studies that show that when responding to questions, to the normal exams, medical exams, AI by itself performs better than a clinician plus AI, which perform better than clinician plus Google, which perform better than clinician by themselves. So if you now have this thing, the AI that knows the answers better than the doctors, then what is the role of the doctor? And how do you integrate it safely into clinical practice? So that I thought was really, really interesting. Then I told you a little bit about the AI dashboards. There are quite a few AI dashboards presented. This was all about analyzing clinical notes, either from medical students or from residents, and kind of seeing like what the quality of the reasoning was, and also or working as a coach to help them write better notes, and not just to help them write better notes, but also to get better medical reasoning from the students and the residents. And then there were a few programs that were like kind of like virtual patients that you went through this whole thing with AI where you'd present a patient, you'd ask questions of the patient, then you'd order tests, and then based on the tests, you then decide on like what to do, and then at the end it would grade you, like it would look at what you did and see like and give you feedback of like maybe here you should have ordered a different test, maybe you should have asked more questions during history taking, that sort of thing.
Excellent. And did you find that schools are teaching about AI or are they more teaching with AI?
Yeah, that's a key question. So I think the shift is to teaching with AI. There's more
Mhm.
and more. So like all of these, the dashboards that I was telling you about and the virtual patients, all of that is more with teaching with AI. But what was really interesting about the Data MD project that I told you about was that it also has a strong component of teaching about AI and like the ethics of using AI and literacy. So basically, literacy. So learning about AI. What can AI do? What is AI good at? And what are we humans better at? And how to integrate the two. That is still a big part of the curriculum as well. And I think the consensus is that the best programs do both. The best programs both improve AI literacy and also help you learn faster, better, more enjoyably by using AI.
That's
And then,
amazing.
yeah, a soundbite like from the conference that I thought was quite interesting. Someone said AI isn't just a topic anymore; it's a collaborator in the classroom.
Hmm. I love that. And I think there's also an obligation as a physician to know how your patients are using AI
Mhm.
tool you too. Like you can't just stick your head in the ground and pretend like it doesn't exist. I
Yeah.
was just speaking yesterday with a neurologist about ALS and he told me
Mhm.
more and more that can be a tough diagnosis in the beginning. The symptoms can
Mhm.
be kind of subtle and more he sees patients come in who put their symptoms into Chat GPT and it says you have ALS.
Oh.
And there's so many implications to that, right? Because
Mhm.
that's a devastating diagnosis that patients might be finding out at home on their own through
Mhm.
ChatGPT. And you know, what is that capable of? How do you handle that when somebody brings in that information? There's so much to that.
Mhm.
Besides using it yourself, is what does it mean when patients start using it as well?
Yeah, yeah, 100%. And there's also we can't be, one of the things that the promise of AI is that it can, like things that were not possible before, maybe now are a little bit more possible. Like you couldn't read all of the notes from all of your residents and give thoughtful feedback, right? And AI can kind of like help with that process. Similar with patients, maybe there is a way to where patients can start chatting with a chatbot, which can then prioritize people that like can triage and prioritize people that like should definitely go to the emergency room right now. So like maybe scared parents at 1 in the morning can like chat to a very good AI chatbot before going to the emergency room with their newborn baby type of thing.
Yeah. Yeah. I've worked on the back end of many programs like that. So it'll be interested to see where they go. There's definitely a reluctance, I think, to put anything out there unless it's 100% perfect,
Mm-hmm.
right? Because it's
Yes.
an area where you don't want any margin for error.
Yeah.
But I think we will get there for sure. Yeah.
Yeah. Yeah. 100%. Yes, I agree with you.
So, Nuria, I know the term precision education is popular in this space, but I'm not terribly familiar with that. Can you explain to us what that means?
Yes. Okay. So precision education is, I think we in the CME world, we call it personalized medicine, or like personalized education. It's basically personalized medicine for learning. It's like, imagine you know a lot about, so in any given topic, you might know more about like the pathophysiology, but maybe you need to learn more about the treatments. And student B might be the other way around, for example. So it's kind of that, is like tailoring it to what you need personally and what you in general as a student, and then maybe as a professional, tailoring it to what you need now for this one patient that is in front of you. And the idea here is that AI can really help foment this, right? Because AI can tailor feedback, pacing, and complexity to each learner. So I was telling you, like, if as learners go through these platforms where they're like doing the history taking, and then they ask for different tests, like the AI can then be like, okay, so they may need a little bit more training on this aspect of history taking or this aspect of the physical exam, while student B maybe needs to learn more about different diagnostic tests or something like that. So it's like the idea is that AI will allow for getting like all of these analytics about learners and how they are learning, and then you can give mentorship at scale, right? So the same
Mhm.
way that I was telling you, like you can't read all of the notes from all of the residents. Well, AI can, and can pinpoint like where do you need to give individual feedback to each of the residents, right? So it's mentorship at scale.
That makes sense. I imagine that, and I've been out of the undergraduate medical education world for a little while now, full
Mhm.
disclosure, but I believe it's still a competency based model. So that sounds like it fits well with a competency based model, right? We're already telling
Yeah.
residents you need to master these 50 competencies to graduate. And
Yes.
then you can incorporate AI if somebody has not mastered a particular competency to give them targeted education in that area. Is that the idea?
Yes. And also, like, actually that was a part of the discussion, is that should you make AI literacy a competency? Like should you
Mm.
have, or a list of, or should you be more nuanced and have like more minutia, like different types of AI literacy? And then someone else like was saying, no, but like AI competency will be like inbred into like all of these other competencies, because we're going to be teaching all of these competencies using AI. So it's really interesting, and that goes like to the next point, which is like where things are going. And like one conversation that was a lot there was that we need national standards for AI competencies. What do doctors and healthcare professionals in general need to know about AI? We need to have an idea like of what are the minimum requirements for good healthcare.
That's interesting to think about because it seems like such a moving target, right? What you need to know about AI right now is kind of different from what you needed to know a year ago, and it's probably different from what you need to know a year from now. So that's hard to keep up with in the education world.
Yes. So how do you think about the competencies in that sense? So like for example, you don't want people to, or at least 2 years ago, you didn't want people, doctors, to like fully depend on ChatGPT for like, these are the symptoms from my patient. What does the patient have? And then just let ChatGPT be the diagnostician, right? But maybe it is important that they understand about hallucinations, that they understand about possible biases, that they understand about if you only input if you forget to input some parts, maybe you will not get a complete answer, and things like that. So how to maintain critical thinking in the age of AI, I think is going to be very important as a competency.
Absolutely. I know educators are struggling with that at every level, right?
Mhm.
Especially
Yeah.
kids in high school. How do I teach them to write a paper if AI can write their paper for them? So it's a challenge across the board right now, and I'm
Mhm.
excited to see where it goes. Awesome. Well, that is it for today's episode. That sounds like an awesome conference you went to. I'm glad you're able to make it. Do you think you'll go to this conference again in the future?
Maybe. I'll see what the sessions are like. So they do this conference every 2 years. So I have
Okay.
some time to think about it.
Okay.
So in 2027, I'll see what the sessions are about, and I might go because this is so focused on academic medical education. I wanted to go because I wanted to see what they were doing with AI, but maybe our conferences will start being more AI forward like this one, and I will not feel that big of a need to go to academic medical education conference to
Right.
know what people are doing with AI. Yeah.
That makes sense. Well, I'm glad you got so much out of this, and thanks for sharing everything with us today. I found this fascinating.
Thank you, Morgan.
Have a great day.
You too.
Bye.
Bye.